As we mark Breast Cancer Awareness Month, we are looking this morning at what happens after a diagnosis. We're joined by Dr. Lori Medeiros, Director of Rochester Regional Breast Center. Good morning, Doctor. How are you?
Good morning. How are you?
Doing well. Good to have you with us this morning.
Thank you. Thanks for having us.
Talking about that key moment after the diagnosis, I imagine so many emotions going through a person's mind as they've just been told that they've been diagnosed with breast cancer. What happens next?
Yeah, I think it's such a difficult thing, because most women walking into a mammogram really aren't expecting something like this, because we almost imbue our mammograms with almost a mythical quality, right? It's you have it, you're done, you're good. And really it's just a snapshot in a moment in time. So I think, the biggest thing that I would advise women to do is just take a step back and know that, we've come a long way in the diagnosis and treatment of breast cancer, so that, we're seeing more women at an earlier stage, better prognosis, better biology. And that really opens up the door for us for a lot of treatments that previously weren't an option. So there's a lot of ways to be able to get through this with pretty minimal trauma in terms of surgery, in terms of radiation. There's a lot of new advances that help us to kind of target that therapy and avoid some of the side effects that people worry about the most.
Yeah, you touched on the technology, and I want to get to that in a moment, but you also mentioned trauma. And I'm thinking mentally for people who are just trying to wrap their head around what they were just told by the doctor. It's overwhelming. What are the next steps in terms of helping someone mentally process this before they can think about that road to recovery and treatment?
Yeah, I don't know that there's honestly much more than trying to get your information straight as quickly as you can.
Yeah.
So I think, the first step is take a breath, understand that generally speaking, most women that present with breast cancer really are in a very treatable stage, very good prognosis, usually quite early. And with that comes, some sense of you can get through this.
Yeah.
I think it's time, right? There's nothing else other than time. You need to go through that process. And for most women, to be realistic about it, most women, that journey is not, a matter of weeks, it's a matter of months. So it's really, really kind of getting your head around, this is going to be a period of time. It's treatment. It's not your new life. And it'll end, and you'll move on.
Yeah. And there are a number of treatment options available, surgeries included. Can you elaborate on what is out there for people to consider?
Sure. I think the thing that I'm most excited about is really the advent of technologies that help mitigate some of the worries of overtreatment. So one of the concerns that people often have when they're diagnosed with breast cancer is how much treatment's enough, because none of the treatments are things that you would willingly go out and do. And so things like intraoperative single-dose radiation for me is a very exciting thing. Single-dose intraoperative radiation has to do with, instead of the traditional way of doing radiation, which is we do our surgery, our lumpectomy, a couple of weeks to a month later, women start with whole breast radiation, which is really a series of daily visits back and forth. For a small group of women, we're able to do something called intraoperative, which means while the lumpectomy cavity is open, our radiation team actually comes in, we deliver the entire dose, and then close up and we're done, which when we're talking about the road to recovery, partially getting there really starts once you're done with a lot of the treatment that people worry about. So It does take quite a lot of the anxiety out of it. And it does mitigate quite a lot of the concerns people have with exposure to other organs, other side effects of some of the treatments.
Yeah, there have been strides made towards the fight against breast cancer. Where can people go for more information if they're just beginning this journey or want to be proactive in their health care?
Yeah, I think any of the large cancer societies offer good information. What I often encourage women to do is look at the big societies, but understand that breast cancer is a bit of an umbrella diagnosis. So The only thing I would say to stay away from initially is opinion pieces, blogs, things like that. Not that
Yeah,
there's not value in that, but it's very specific to a specific journey and a
sure.
specific person's understanding, you know? But I think always the American Cancer Society, Cohen Foundation, there's a lot of good, our website, Rochester Regional Health, there's a lot of really good websites that at least can get you started with ideas or understanding a little bit what the terminology is going to be. Typically, a first visit with somebody really, we spend an hour or more with that person just going through things. And they may have 2 or 3 visits even before they get into their treatment with various members of the care team so that they really understand what it is that they're choosing.
Sure. Dr.
So
Medeiros, we are running out of time. Thank you so much for this good information, a wealth of good support systems here in Rochester that people can find. We'll have that on our website. Have a great day, doctor.
you too. Thank you.